What we look for in a genetic test is to see if we can find what's called a genetic mutation. That means we're looking to see, do you have any changes or abnormalities in your genes that you were born with that could increase your risk of developing multiple types of cancers. During this video, I will explain what cancers and genetic mutations are included in the genetic test. First, I want to assure you that it is rare that we find genetic mutations in people. Only 5 to 10% of the population has a hereditary reason that they were born with that could increase their risk of developing cancer. However, anytime we see certain red flags, such as young breast cancers, rare cancers such as ovarian, pancreatic, and metastatic prostate, 3 or more relatives diagnosed with breast cancer on the same side of the family, we want to rule out a hereditary cause for cancer. As you know, cancer can be caused by lots of different reasons. Sometimes it's sporadic cancer, which means sometimes a person develops cancer simply by chance. Sometimes it's environmental exposures, like being exposed to chemicals or pesticides in the environment. And sometimes it's lifestyle choices, such as smoking, drinking, or taking hormone replacement therapy. There are lots of different causes of cancer, and genetics only play a small role in cancer development, but we do want to be sure that you don't have a genetic or a hereditary reason that could increase your cancer risk. If you find out that you have a mutation, it had to have come from one of your parents. If you're your mom or your dad, if either one of your parents had a mutation, they had a 50% chance that they could pass that mutation and those cancer risks on to you or to any of your siblings. Same for you, if you have a mutation, there is a 50% chance you could pass those cancer risks on to your children. So knowing this information, it can be beneficial not only for you, but also for your other family members. The test that we do looks at 34 different genes. We look to see, is there a problem in any of these genes that would be a hereditary reason that could increase your risk of developing any of the following types of cancers. It looks to see if you have an increased risk of developing breast, ovarian, colon, uterine, melanoma, pancreatic, stomach, or prostate cancer for your male relatives. Sometimes it can identify other cancer risks, but these are the 8 main cancers that this tests for. If we were to find that you have a mutation, the test tells us exactly which of the genes that we're testing has the problem in it, which of those cancers that you or your family members could be at risk of developing, the percentage chance that you would get those cancers, and then what should we be doing for you. If we were to find that you have a mutation, we would recommend to refer you to Highlands Oncology Group here in town to this genetic counseling clinic that they have. We recommend that you meet with their genetic doctors and genetic counselors, and they talk with you in depth about the mutation that was found, what your options are, and help you come up with a management plan. For example, if we were to find that you have a hereditary reason that could increase your risk of developing breast cancer, you would have several options as far as what you might want to do about that. One option is just let us watch you very closely for breast cancer. If we were to find that you have a mutation, we would recommend that you come in every 6 months and let us do either a mammogram or an MRI screening on you, one or the other every 6 months. There are also medications that you can take to lower the risk of breast cancer. And then some people choose to have surgeries like mastectomies and remove their breast tissue preventatively. That is a personal choice. No one makes you do that, but they do sit down with you at the genetic clinic and they go over all of your options for each of the cancer risks that could be associated with the mutation, and then you decide what's best for you and for your family. Some of the mutations that we find only carry a small increased risk of developing cancer, like a 10% chance that you might develop some of these cancers. Some carry a higher risk, like a 70% chance, and so it can be helpful to know what your risk of these cancers are when you make your management decisions. And if we were to find that you have an increased risk of developing some of these other cancers besides breast cancer risk, then at the genetic clinic, they may refer you to other doctors if that needs to be, but they try to make sure someone's watching you closely for all of the cancer risks that could be associated with the mutation. All of this that we just talked about is a positive result and what this test could tell us. Other results that we could get from the test is a normal or a negative result. That's great news. That just means we cannot find a problem in any of the genes that we're testing that we know of right now that would be a hereditary reason that would increase your risk of developing any of the cancers that we're testing you for. That is the result that we want to get from this test. But we would still say, even if the test comes back normal, although that is great news, But breast cancer, any cancer, it could still happen even without a hereditary cause for that. So we would still say just be diligent. Keep getting your mammograms every year, and as recommended by our doctors, still do all that we know we need to do to detect breast cancer early if it did happen. The last result we could get from the test is what's called a variant of unknown significance. That means that we do see a change or an abnormality in one of the genes that we're testing, but we're not sure if it's a normal benign change or if it's something that could increase your risk of developing these cancers. When the lab sees this, they research these variants until they do feel comfortable coming back and giving us a final answer of what this means for you. And they research it, but it could take weeks to years before they can get back in touch with us with a final answer. We treat this as a normal finding. We tell our patients try not to worry about this type of result. I know that's easier said than done, but the reason is 90% of the time they get back to us after they've researched this and they say it's nothing of concern. It's a normal change that makes you unique and different, but it's not anything that would increase your risk of developing cancer. But there is a rare chance that they could come back years later and say they did find out new information and this could increase your cancer risk. And not to say you would have this type of finding, but it can be fairly common. So we do want you to know it's possible. Does not mean your whole test comes back unanswered. It just means we may be able to give you answers on the majority of the genes, but we might need to research 1 or 2 more genes and get back to you in the future. If the lab comes back and says the variant is something that will increase your risk of developing cancer, we will call you and let you know what you need to be doing for the associated cancer risk. As far as insurance coverage goes for the genetic test, most insurance companies cover genetic testing when you meet the national guidelines for testing. However, we do not file the insurance at the breast center. We will discuss the insurance process in further detail at your risk assessment appointment. Another question that we get regarding insurance is about insurance discrimination. There is a law that protects against any type of health insurance discrimination based off of a positive result. They cannot drop you from your health insurance or raise your premiums if the test comes back positive. The law does protect against health insurance and employment discrimination. It applies to all health insurers and all employers, except there are 2 exceptions to this rule. One is if you work for a company that has 15 or fewer employees, then they don't have to follow that, or if you have military insurance, that's the 2 exceptions. But again, the law protects against health insurance and employment discrimination, but there are no laws that protect against life insurance discrimination. If you have life insurance, you cannot be dropped from the existing life insurance policy that you have. However, if you do try to change life insurance companies or policies in the future, they can ask you this as a pre-existing health condition. If you said that you had a mutation, they can say, we're not going to pick you up for life insurance, or we will, but it will cost more. However, what we are hearing, life insurance companies are not currently asking this question, and they say they have no plans to start asking this in the future, but we do want our patients to be aware there are no laws to protect against life insurance discrimination like there are for health insurance. If you come back positive for a mutation, we would encourage more family members to be tested. If you are negative for a mutation, then this does only tell us about you and your genes. There still could be a mutation in your family, you just did not inherit that. Even if you're negative, other family members such as parents, siblings, aunts, uncles, cousins, they may still all need a test despite your result. The good news for you, if you are negative, you would not have anything that we know of right now that you could pass to your children. That would increase their risk of developing any of these cancers that we're testing you for. We would feel good about your children. They would not need a test if you're negative unless their other parent has cancers on their side of the family. There is still a chance they could pass them a mutation even if you do not have one. It takes 4 to 6 weeks to get the results back, and I will call you on the phone and go over your genetic results with you over the phone. It is a blood test. If it is something that you want to do, I will draw your blood for that during your risk assessment appointment. Please ask the nurse during your risk assessment appointment if you have any other questions on material that we may not have covered in this video.